قرب تري شوي، قرب قرب ليكرون، قرب ماكسيموم، قرب قرب قرب. زيد 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 زيد. هبط الكاميرا شوي توا. نهد اجا، اغزر لي اجا من قدام باش ترى الكاميرا نتاعك فاش معوجة. زيد قدم، زيد قدم قدم الماكسيموم، قدم. هبط الكاميرا نتاعك توا، استويها. بعد يديك عطرة. دورها الغادي شوي باش نهد. ما تنجمش تستويها وانت هي باش تطيح لك، ما عادش تغزر للاكران، ما عادش تغزر غادي ركعها، ما تغزرش الغادي عندي انا هذاك. خليك هيك. يجي بعد لي الخيط الازرق اللي قاعد عليه. So we are doing our screening colonoscopy in a 16 years old man. We are in a supine position. So we'll begin our colonoscopy. I will inspect the entrance, the rectum. We are using an Olympus 1100 TXE mod, and I will do it underwater, so I won't insufflate a lot of CO2. We have a history of left colon LST in 2021 with low-grade dysplasia. So as you see, I'm advancing slowly my scope with the water installation, and anytime I will find some residue, I will just wash and absorb it. I'm using my right hand to turn left-right, so we torque the scope to the right to go to the right, like this, and I'm using the big wheel up-down to change my direction, and I'm not putting any CO2 now, only water. So we're advancing slowly. Here it's a sigmoid loop, I think. We are at 30 centimeter. So I push slowly. I should go to the left. And if I torque a little bit to the left, it will be the upper direction here at 12 o'clock position. So I'm pushing slowly my scope. And this is my lumen. So I have to follow the lumen. And as you see how the clear image we have underwater, I think we are in the left column here. We will clean a little bit before advancing. At 45 centimeter, always putting water, not air or CO2. And you see how it opens slowly. Here I'm cleaning, putting water and cleaning. We'll advance slowly. So the purpose now is to go to the end of the column and inspect while introducing the scope, and the main inspection will be done when pulling back our scope. So I feel there's a little loop forming here. So if you see when I push my scope, it doesn't move. I can force a little bit and try if I can advance with this little loop, and we'll see. So it's okay, it's advancing. The lumen is at 6 o'clock position now. I have a loop coming. So for the loop, two choice, I can force and I can come back like this. I don't have any loop now here. You see how it moves easily. So I will change the stiffness of my scope and put it on 3 and try to advance. I put some gel on the insertion tube and we are advancing, but we have still a loop here. So I will advance with my loop and then try to pull back the scope and avoid this loop. So I think this is the left flexure. I change the position of my scope. I'm trying to see where is the lumen. I will turn the little wheel to the left and try to find it, but it's still not clear. Now we see it clearly. It's at 6 o'clock position. So big wheel down. I will turn a little bit to the left to find my lumen, which is coming here. The big wheel down, and this is my lumen. I will suck some air and push slowly or pull back my scope. I will try to push and to force on my loop, and you see how it advances slowly. So all you have to do is to push really slowly and try always to put the lumen in the middle like this. I have of course always my loop. This is the another flexure. I think this is the left, the right one, I think. So I will just use my big wheel down and the lumen is at 6 o'clock position. I can't advance more my scope, so I have to pull it back and try to turn to the left or to the right while pulling back to shorten my scope and avoid this loop. So I'm turning the little wheel to the left like this. I'll change all the direction of my scope. So we aspirate all this water and air to clean and shorten our column and try. Maybe we can advance here, but you see as I advance the loop forming there. So I can force on the loop slowly and see if I can reach this flexure, which is coming slowly here. And while I'm getting a better view here, I will suck the water to see where I am exactly. And I will turn just right or left to try to put my lumen in the middle. And I will suck, and this is the end of the colonoscopy. We see the cecum there. So now the purpose is to go to the end of my cecum, which is just facing me. We are at 70 centimeters from the anal verge, and we are at the end of our colonoscopy. This is the entrance of the ileum here. We can try to go in, but I will wash before and try to go to the end of my cecum. You see that I'm pushing, but that doesn't advance because we have this loop. But I think with some movement we are here at the end, really end of the colon, and this is the cecum. So now the inspection will begin. I'm sure this is my cecum. I will pull back slowly my scope, moving left, right. This is surely a scare of previous polypectomy. This is the appendix orifice. So to know that you are in the cecum, you have to see this appendix here or the ileocecal valve. We see twice of them. The appendix is here. I will clean a little bit to see more. Nothing around it. So if I want to fill all the cecum with water, I have to get out the air. And this is a view that we can have with the water. So now we'll inspect and pull back slowly our scope. As we said, this is a ileocecal valve here at 6 o'clock position. We can access easily our ileon. I think we will just pull back slowly and advance. And you see it's at the 7 o'clock position. So if I turn a little bit my scope to the left, without pulling back, or maybe just slowly pulling back, we see on the left part of the cap, we should begin to see our ilium. It's at 7 o'clock position, and we can enter easily now just by little movement. And we see this is our ilium. We will push our scope, put some water, and it's look clearly normal. So I will pull back slowly my scope. There's nothing special here. So I will go out now and begin my screening colonoscopy. We have the choice between the NBA mode and the TXE mode. So we'll use the NBA mode for polyp detection. I would like to do it underwater, but it's not really clean here. So the cecum is okay, there's nothing to see. This is a suction lesion. Now we'll suck all the water here before going out from the right colon. I think it's not so clean in the right colon. But I don't see any lesion here. And this is the kind of picture we have to get. Everything is clean. And this is the bad one. So the difference, you can't see the mucosa with this residue there. But if I clean it, I will see it better with so this is what we want to get. All is clean, clear. And we pull back slowly while inspecting. We can use the TXE mode or the NBA mode. Really, I prefer the TXE mode in underwater. So this is the end of the right colon. So I will suck the maximum of water. And then I will come back to my left colon, the transverse and the left one. And as you see, it's not enough clean here, so I will clean it a little bit and put again some water. And you see how the cap is helping us to see. So we can see under the fold. We can move the fold left, right. This is the underwater technique. And this is the air technique. So you see clearly the difference between the mucosa there and the mucosa here. We have the zoom effect of the water, and we see really clearly the mucosa. And if I turn a little bit to the right, I see the air technique, the usual one. I will suck the air here now and replace it by water. So all this segment is okay, so I will come back again. I will put NBA to check again. So this lesion is due to the suction. We can use our near focus mode as only lesion from the suction. No polyp here. We come back to the TXE mode. I'm not putting any water now. This is the air view and this is the water view. We are at 50 centimeter. This is, I think, the end of the transverse column. We will go now to the left column. So I will just suck some water. So if I want to fill all the space with water, it will take time. So I have to suck the air like this and then put my water. So always use the white color light and the NBA mode. And it's a beautiful picture here. So at the left part we have the underwater, and in the right part, if you turn a little bit, it's the air. This is the end of the transverse column. We are at 55 centimeter, 50 centimeter. So the underwater here, and always at the left part with the gravity is at the left side, and all the air is going in the upper part, which is at the right part. And anytime you have a lesion, you have to focus on it, come close, put your NBA like this, use your dual focus here, and you see how beautiful are this picture. And this is the inspection without putting any water. I think the left column is fully filled with the water. So we have to pull slowly now. Some bubble of air. I will clean this water a little bit. And all the water in the right column is coming. And you see, without putting water, I aspirate the right column water, which will come to the left one. So I won't need to put more water. أعطيني فالف حمراء. So this is the most important place to watch here, is the left column where we found the last, c'est bon, the last polyp 4 years ago in 2021. So I will take my time. And you see how helpful the cap is helping me to look behind the folds. And you see this little lesion here. أعطيني pince. It looks like a serrated lesion. So it's the 1-2 millimeter lesion. So I will take it with a biopsy forceps. It's really important to focus on the lesion because we can lose it easily. So I will just keep my cap locked here. Some bubble of air are coming. I can lose it easily, so I will focus and wait until my biopsy forecast come out. Hello. It's in the middle of the screen. I will just get, the air is disturbing me, so I will try to get it out. Sakura. And this is our lesion taken. So before taking out the biopsy forceps, I will wash and be sure that nothing remained there. So it is a lesion at 40 centimeter, but 1 millimeter lesion. So we'll suck all the water, dirty water here. I see something here. If you want to look behind this fold without the cap, it's impossible. You have just only to wash. But with my cap, you see what I can do. I can turn a little bit my scope to the left and use the big wheel up And you see how all the folds are opened. So if I want to see behind this one, I can go behind it and use the big wheel down, put some water, and pull back a little bit my scope, and you see the fold is fully explored. So left right with my hand. I don't need to torque from here. I can leave this hand free, the left right one, and I use only to pull back the scope. And we see something here. So it's maybe a low-grade dysplasia polyp. It's flat one, Paris 1S. So for that, if you want to have an idea on the size, it's the half of the cap, which is a 15 millimeter cap, so it's 8 millimeter. So the best solution for this kind of polyp, the inspection show the pit pattern here, the vessel pattern. We can put some zoom on it, and you see. So I have the zoom, the magnification with the water, and we see how big it is. But don't forget we are on zoom, so I will deactivate the zoom. This is our polyp, and it almost more than half of the cap. So we are at 10 millimeter lesion. We have just put it at 5 o'clock position, so I will take my cold snare. So it's we're using the new cold snare from Microtech with a metallic sheet at the end. هل هل سكر شوية سكر. So it's monofilament one. سكر سكر شوية سكر شوية سكر سكر. So we see the metallic end. This is helped to cut. The other snare has a plastic sheet, so sometimes it doesn't cut. So I will put some water. حلي بشوي حلة. حل 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 حل. So this is my snare. هذه 10 ملم ولا 15؟ ما عندكش 10؟ ها؟ تكلم بالقوي فمش هكا، فمش 10 هكا. So it's 15 millimeter. It's too big for this lesion, but we'll do with it. So سكر لي شوية سكر شوية. I will close a little bit. سكر شوية سكر سكر. استنى ناهد أمانك أسمع كلامي وما تغزوش الإكران. حلو. So it's really important to be hearing what we are saying. So I want to take the distal part here. The distal part is okay. ابدأ سكره. ما تقصش. So I will check now if I have all the lesion. So we see the folder there, and there's a little lesion at the 3 o'clock position. So I will take my specimen inside the channel, and it's cut, and I suck it directly, so it's in the channel now, so it will go directly to the polyp trap. So I won't lose time searching for it. So we put some water and see, and check if we get it in the polyp trap. and then we'll inspect. C'est bon. خلي غادية. So the polyp is catched. So now we have to check for the scare. ما عادش عندي ماء. ما عادش عندي ماء. برا جيب لي ماء. برا جيب لي ماء. هز هذي وعبيها بالماء. هو بيني برا في ساعة. So we don't have water for washing, so I will put some CO2. I will search for the lesion. We will found it easily. I will switch to the TXE mode and try to see the blood. Where is our blood? So it should be here at 5 o'clock position. So I'm pulling slowly, and lesion is here. We see some blood here. And this is our scare. So I will put it in the middle of my cap. I will put my near focus mode, and I'm sure my edges are okay. Tiny Panstra. I think something remaining, it's not sure, but we'll take it with a biopsy forceps. So it's really mandatory to be sure that we don't leave anything. This is the purpose of the inspection. This is a submucosal layer. Hello. So I want to grasp this little part here, what you see at the 5 o'clock position. Sakura. So we take it fully, so I'm happy with this. I'm sure we don't leave anything. حط فرد فلاكون هي الوحدة. مش الفلاكون الأولى. So here we are at 40 centimeter. So what I try to do when I remember to put on the screen the distance, which is 40 centimeter. So we come back now for the inspection. We have 14 centimeter to inspect, and you see how the underwater technique is really helpful. We didn't see this polyp while we are entering the colon. Our scare is there. Of course, I won't put any clip to close it. It's a little bit bleeding, but really it's called snare, so I don't worry about it. So this is our beautiful scare. So I'm taking out the water in the right and left column here. And now I will come back to my last 40 centimeter. And you see it's not really clean here, so I will clean it. Put my water, pull back. This is the air view. So really the difference is really clear between this view and this view. And look, if you put it in the middle of the screen, we have at the left position the water view. So at 30 centimeter, a lot of folds here. It's the sigmoid loop. So we try to spend some time for inspection here. So I don't see anything, so I will pull back slowly my scope. Just try to inspect. And we can see this little polyp, but it's a hyperplastic polyp here. Atténuance. So you can take it out with a biopsy forceps or with a loop. I will use the loop. I will try to put it at 5 o'clock position, like this. It it will facilitate the loop insertion. I'm not sure to be able to get a best position. So I will come back to my first position. It's hyperplastic one, so even if we leave it, if maybe 3-4 millimeter size, I think we will leave it. It's at 15 centimeter. I see it just here. So it's really little. It's really little one. So I will use a 15 millimeter cold snare. I don't open a new one. حل شوية. Stop it. So I put the tip of the snare on the upper part like this, and I will just turn a little bit to the left, to the right, هذا سكرة. So we get it on in قصي. We inspect our scare here. It's bleeding, but as we said, it's a cold snaring, so it won't be any problem. It will stop alone, just stopping now. The edges are okay. I will watch a little bit to have a better view, because with the blood, so it's clear. I will suck the water and finish my inspection. This is the rectum now. So for the rectum, you have to exsufflate all the air and replace it with water. And you have this long tube. We have, of course, to clean the water. So I will take all the water now out and just put some CO2 in the rectum to inflate it. مش طوى كمان نسيها. We feel little 1 millimeter polyp here. It's a hyperplastic one, so I won't touch it. I will put my air now. بدل التصنع الجاية. I will come back to my TXE mode. This is the anal dredge. We see some hemorrhoids while going in. We'll inspect them again, but I will suck all that water now. And I really want to inspect all the rectum and the sigmoid here. So we see it's really clear. So I will try to suck the maximum of water. This is a little hyperplastic polyp. I won't touch it. We put our NBA mud, and now I will fill with air, CO2, sorry. And this is the anal verge, as we said. Hemorrhoids will begin here. And you see how the water is coming, so I will suck it here a little bit to help. And this is the end of our procedure, so we don't have nothing, only these two polyps and these hemorrhoids here. So if we put the near focus mode, you will see this little vessel here. I